of our kidney health and to share our gratitude to two of our eminent personalities who play a vital role in YSH with regard to healthcare related to kidney, Dr. Ashok Pandit and Dr. Santosh Pai. I would also like to share our gratitude to our beloved Director Medical, Dr. Mohammad Tahir, for being here amongst us, sparing off his busy schedule. I request the ever-energetic personality, Mr. Bhaskar Aras, to please come forward and escort the dignitaries to the dais.
Come.
Thank you, sir. I now request our Medical Superintendent, Dr. Savita Shetty, to please come forward and share a floral welcome to Dr. Ashok Pandit. I also request our sir, Bhaskar Aras sir, to please come forward and give a floral welcome to Dr. Santosh Pai also. Thank you. World Kidney Day is a joint initiative of the International Society of Nephrology and the International Federation of Kidney Foundations. World Kidney Day is a global campaign aimed at raising awareness for the importance of our kidneys. Awareness about preventive behaviors, awareness about risk factors, and awareness about how to live with a kidney disease. We do this because we want all our kidneys to be healthy. Before we begin the special occasion, we shall seek God's blessings. I now request Dr. Radhika, Mrs. Anita, and Dr. Swati to please come forward and recite a prayer song.
The 2022 theme is Kidney Health for All. Bridge the
knowledge gap to better kidney care. This year's campaign focuses on efforts to increase education and awareness about kidney health and on reducing the high CKD knowledge gap at all levels of kidney care. I, Dr. Swati, deem it a great honor to deliver the keynote address of our two eminent doctors, Senior In-House Consultant Urologist Dr. Ashok Pandit and Senior In-House Consultant Nephrologist Dr. Santosh Pai. Dr. Ashok Pandit, born in 1960 at Madras, finished his schooling and PU at St. Aloysius College, Mangalore. He completed his MBBS, MS in General Surgery and MCH in Urology at KMC, Mangalore. He started his career as a Senior Registrar in General Surgery and later in Urology at KMC, Manipal in the year 1989. He was an Assistant Professor in Urology at KMC, Manipal and a Consultant Urologist at Upasana Hospital, Quilon, Kerala between the year 1993 and 1996. He was appointed as a Director and Consultant Urologist at Mangalore Kidney Foundation, Mangalore from 1996 to 2017. He was an Assistant Professor in Surgery and Associate Professor Urology between the year 2000 and 2012. He was a visiting faculty for DNB Urology at KMC Mangalore in 2015. He is currently a Senior Consultant Urologist at our hospital since June 2017. He has received the Best Urodynamic Award at the UCCON 1994 to attend the International Continence Society meeting at Sydney, Australia. He was the first urologist to do percutaneous nephrolithotripsy on a regular basis at Mangalore. He was the first to introduce ESWL and C-arm for urological use. He was a full Euro workshops every year. He has been on the teaching faculty to CUEs and endourology workshops. He was a past president of Karnataka Urology Association. I welcome you. He started his career as a house surgeon in Vijayanagar Institute of Medical Sciences, Bellary. He continued his service as a casualty medical officer in Highland Hospital, Mangalore. He was a clinical assistant professor of medicine in nephrology at Amrita Institute of Medical Sciences, Kochi. He started the nephrology department at Yenepoya Medical College Hospital, Delakate, which had only 2 dialysis machines and is now having 21 dialysis machines. Along with the hemodialysis procedure, other procedures such as plasmapheresis, renal biopsy, live and cadaveric renal transplant, and tunnel catheter placement have been done under his guidance at the same hospital. He started lymphocyte cross-match facilities. He is Associate Editor for Archives of Medical and Health Sciences Journals. We welcome you, sir. Today, we have amongst us 4 patients who have been treated by Dr. Ashok Pandit, Dr. Santosh Pai at Yenepoya Specialty Hospital. I welcome Mr. Ganesh Shetty, Mr. Shekhar Moini, Mr. Ramchandra Bhandari, and Mr. Harish Shetty. I now request Dr. Priya Nayak to give a floral welcome to Mr. Ganesh Shetty. I request Mrs. Mamta, Manager Support Services, to give a floral welcome to Mr. Shekhar Moini.
Well, for the information of all, I am accepting this floral welcome on behalf of my wife, who has been undergoing treatment for the past 14 years under the guidance of Ashok Pai.
Thank you, sir. I request Mrs. Sharmila, HR and Admin Manager, to give a floral welcome to Mr. Ramchandra Bhandari. To come forward and share his view on this occasion. I request Dr. Santosh Pai to say a few words on this occasion. Over to you, sir.
ನಮಸ್ಕಾರಗಳು ಎಲ್ಲರಿಗೂ. ಇಲ್ಲಿ ನೆನಪಿರುವಂತಹ ಎಲ್ರಿಗೂ ನನ್ನ ನಮಸ್ಕಾರಗಳು. ಎಸ್ಪೆಷಲಿ ಡಾಕ್ಟರ್ ತಾಹಿರ್, ಮೆಡಿಕಲ್ ಡೈರೆಕ್ಟರ್ Yenepoya ಸ್ಪೆಷಾಲಿಟಿ ಹಾಸ್ಪಿಟಲ್. ಐ ವಿಲ್ ಟ್ರೈ ಟು ಸ್ಪೀಕ್ ಇನ್ ಕನ್ನಡ ಆಸ್ ಮಚ್ ಆಸ್ ಪಾಸಿಬಲ್. ಗೊತ್ತೇ ಇರಲಿ ಪ್ರಾಬ್ಲಿ ಅವಾಗಿರುವ ಫೆಸಿಲಿಟೀಸ್ ಇರಲಿ ಅಥವಾ ನಮಗೆ ಕಿಡ್ನಿ ಡಿಸೀಸ್ ಬಂತಂತ ಹೇಳಿದ್ರು ಕೂಡ ಟ್ರೀಟ್ಮೆಂಟ್ ಫೆಸಿಲಿಟಿ ಇಲ್ಲದೆ ಇರಬಹುದು. Even in Mangalore also probably dialysis facility and all has come recently around 20 to 25 years back. ಮೊದಲು ಹೇಗಿತ್ತು ಅಂತ ಹೇಳಿದ್ರೆ ಕಿಡ್ನಿ ಪ್ರಾಬ್ಲಮ್ ಬಂತಂತ ಹೇಳಿದ್ರೆ ಆಲ್ಮೋಸ್ಟ್ ಇಟ್ ವಾಸ್ ಸರ್ಟನ್ ಡೆತ್ and even famous personalities also suffered this disease. ಸ್ವಲ್ಪ ಮಟ್ಟಿಗೆ ನಮಗೆ ಕಿಡ್ನಿ ಬಗ್ಗೆ ಜಾಗರೂಕತೆ ಬಂದಿದೆ ಅಂತ ಹೇಳಿದ್ರೆ ತಮಿಳುನಾಡು ಚೀಫ್ ಮಿನಿಸ್ಟರ್, working chief minister died because of kidney disease. He had to go to America for his treatment, probably a renal transplant, but which failed. And ಅವಾಗಿಂದ ಪ್ರಾಬಬ್ಲಿ ಎಲ್ರಿಗೂ ಕಿಡ್ನಿ ವೈಫಲ್ಯದಿಂದ ಬದುಕಲೂಬಹುದು, ಸ್ವಲ್ಪ ಕೇರ್ ತಗೊಂಡ್ರೆ ಕಿಡ್ನಿ ವೈಫಲ್ಯವನ್ನು ಪ್ರಿವೆಂಟ್ ಮಾಡಬಹುದು ಅಂತ ಹೇಳುವ ಸ್ವಲ್ಪ ಜಾಗರೂಕತೆ ಬರ್ಲಿಕ್ಕೆ ಸ್ಟಾರ್ಟ್ ಆಯಿತು. ನಾವು ಎವ್ರಿ ಇಯರ್ ವರ್ಲ್ಡ್ ಕಿಡ್ನಿ ಡೇ ದಿನ ನಮ್ಮೊಂದೊಂದು ಥೀಮ್ ಕೊಡ್ತಾರೆ. ಏನಂತಂದ್ರೆ ಪ್ರತಿ ವರ್ಷ ಪ್ರೀವಿಯಸ್ ಇಯರ್ಸ್ ಪಿಡಿಯಾಟ್ರಿಕ್ ನೆಫ್ರಾಲಜಿ, ಪಿಡಿಯಾಟ್ರಿಕ್ ಕಿಡ್ನಿ ಡಿಸೀಸ್, ಹಾಗೆ ಕ್ರಾನಿಕ್ ಕಿಡ್ನಿ ಡಿಸೀಸ್, ಕೆಲವೊಮ್ಮೆ ಅಕ್ಯೂಟ್ ಕಿಡ್ನಿ ಡಿಸೀಸ್. ಈ ಸಲದ ಥೀಮ್ ಅಂತ ಹೇಳಿದ್ರೆ ಮೇನ್ ಫೋಕಸ್ ಮಾಡುವಂಥದ್ದು ನಾಲೆಡ್ಜ್ ಫಾರ್ ಬೆಟರ್ ಕಿಡ್ನಿ ಕೇರ್. So this theme should have probably come long before than all other themes, because ಎಷ್ಟೋ ಜನರಿಗೆ ಈ ಕಿಡ್ನಿ ವೈಫಲ್ಯದ ಬಗ್ಗೆ ಇರಲಿ ಅಥವಾ ಕಿಡ್ನಿ ಡಿಸೀಸ್ ಬಗ್ಗೆ ಇರಲಿ ಅದರ ಬಗ್ಗೆ ನಾಲೆಜೇ ಇರೋದು ಕಡಿಮೆ. ನಾಟ್ ಓನ್ಲಿ ಇನ್ ಜನರಲ್ ಪಬ್ಲಿಕ್, probably among health care facility ಕೂಡ, health care professionals also. Even majority of the time general physicians or private peripheral doctors also ಕಿಡ್ನಿ ವೈಫಲ್ಯ ಅಥವಾ ಕಿಡ್ನಿಯ ಬೇರೆ ಬೇರೆ ತರದ ರೋಗಗಳ ಬಗ್ಗೆ ಗೊತ್ತಿರೋದು ಬಹಳ ಕಡಿಮೆ. ಪ್ರಾಬ್ಲಮ್ ಏನಾಗ್ತದೆ ಅಂತ ಹೇಳಿದ್ರೆ ಪೇಷಂಟ್ಸ್ ಅಥವಾ ರೋಗಿಗಳು ನಮ್ಮ ಹತ್ರ ಬಂದು ತಲುಪಬೇಕಾದ್ರೆ ಆಲ್ಮೋಸ್ಟ್ ಗೋಲ್ಡನ್ ಫೇಸ್ ಆಫ್ ರಿಕವರಿ is lost. So basically I would say that educating not only patients, probably healthcare professionals also should happen. And kidney disease ಬಂದ ನಂತರಕ್ಕಿಂತ can we prevent this kidney disease? The focus should be on that. We have been trying, ನಮ್ಮ Yenepoya hospital specialty ಇರಲಿ ಅಥವಾ Yenepoya University ಇರಲಿ, trying to ಪ್ರತಿ ಕಿಡ್ನಿ ವರ್ಲ್ಡ್ ಕಿಡ್ನಿ ಡೇ ದಿವಸ ಅಥವಾ ಪ್ರತಿ ವರ್ಷ ಎಲ್ಲ ತಿಂಗಳಲ್ಲಿ ಹಲವಾರು ಕ್ಯಾಂಪ್ಗಳನ್ನ ಮಾಡಿ ಅಥವಾ ಈ ಥರ ಪ್ರೋಗ್ರಾಮ್ಸ್ ಮಾಡಿ ವಿ ಟ್ರೈ ಟು ಗಿವ್ ಸಮ್ ನಾಲೆಜ್ ಅಬೌಟ್ ಕಿಡ್ನಿ ಡಿಸೀಸ್. ಈ ಕಿಡ್ನಿಯ ಪ್ರಾಬ್ಲಮ್ ಇದೆಯೋ ಇಲ್ವೋ ಅಂತ ಗೊತ್ತಿರೋದು ಬಹಳ ಕಡಿಮೆ ಟೆಸ್ಟ್ಗಳಲ್ಲಿ ನಮ್ಗೆ ಗೊತ್ತಾಗ್ತದೆ. ರೆಗ್ಯುಲರ್ ಆಗಿ ದಿಸ್ ಡಿಸೀಸಸ್ ನಾವೀಗ ಹಾಸ್ಪಿಟಲ್ ಸೆಟ್ಟಿಂಗ್ ಐ ಆಮ್ ಸೀಯಿಂಗ್ ದ ಕ್ರೌಡ್, ಮೆಜಾರಿಟಿ ಆಫ್ ದ patients who are on dialysis have come today. Probably what knowledge I preferably say is ಏನಾಗ್ತದೆ ಅಂತ ಡಯಾಲಿಸಿಸ್ ಮೇಲೆ ಇರ್ತಾರೆ, ಡಯಾಲಿಸಿಸ್ ಮಾಡಿಸ್ಕೊಂಡು ಹೋಗ್ತಾ ಇರ್ತಾರೆ. Probably they may not be, say I go to dialysis room, I don't feel comfortable ಅಂತ ಹೇಳಿದ್ರೆ ಪಕ್ಕ ಮಲಗಿರ್ತಾರೆ. They tell their problems to us, the next bedfellow will be hearing. So ಯಾವಾಗಲೂ ಅದೊಂದು ಏನಿರ್ತದೆ ಅಂತ ಹೇಳಿದ್ರೆ ಅವ್ರದ್ದು ತೊಂದರೆ ನಮಗೂ ಬರ್ಬೋದಾ. See, some of them will be in first year of dialysis, some of them will be in 5th year of dialysis. So all those problems, cross-talk, they feel much more confused. So ನಾವೇನು ಹೇಳ್ತೀವಿ ಅಂತ ಹೇಳಿದ್ರೆ ಎಲ್ರಿಗೂ ಒಂದೇ ಥರದ ಪ್ರಾಬ್ಲಮ್ ಬರಬೇಕಂತ ಇಲ್ಲ. ಆಸ್ ದ ನಂಬರ್ ಆಫ್ ಇಯರ್ಸ್ ಗೋ ಆನ್ ಡಯಾಲಿಸಿಸ್, ಯು ಕ್ಯಾನ್ ಇಫ್ ಅಟ್ ಆಲ್ ನೀವು ಕರೆಕ್ಟಾಗಿ ಪಾಲನೆ ಮಾಡ್ತಾ ಇದ್ರೆ ಯು ಕ್ಯಾನ್ ಲೀಡ್ ಅ ನಾರ್ಮಲ್ ಲೈಫ್ ಸ್ಪ್ಯಾನ್ ಆರ್ ನಾರ್ಮಲ್ ಲೈಫ್ with all full activities. I usually say no one dies because of kidney failure. Because of the other effects of kidney failure they die, like cardiovascular, heart disease early. See now ನಮ್ಮ ಬೆನಿಫಿಟ್ಗೋಸ್ಕರ ನಾವು we divide into multiple cardiology, nephrology, neurology ಅಂತ ಹೇಳಿ. But ಮನುಷ್ಯರು ಒಬ್ಬರೇ, everything is interconnected. So probably Bangalore ಹೋಗಿ ಅಥವಾ whatever facilities which is available, probably even in abroad, we at present have in our own hospital. ಎಷ್ಟೋ ಸಲ ನಮ್ಮದು those are working with us only don't know that these all facilities are there. So we are happy to say that we have got a renal transplant team also. We are doing cadaver transplant also. We are registered for cadaver transplant also. We have got a very good dialysis facility also. Yeah, when I come to say about renal transplant, ನೀವು ಯಾವುದಾದ್ರು ಊರಿಗೆ ಹೋಗಿ ಟ್ರಾನ್ಸ್ಪ್ಲಾಂಟ್ ಮಾಡೋ ಬದಲು you can get the same thing in a very affordable rates in our own hospital. Our sir is always the leading senior urologist. He'll always help and tell you everything about renal transplant. Yarella wants to go for a transplant, for a cadaver transplant, our hospital is registered for it. ನೀವು ನಿಮ್ಮ ಡಾಕ್ಟರ್ ಹತ್ರ ಸಲಹೆ ಕೇಳಿ ಯು ಕ್ಯಾನ್ ಗೆಟ್ ರಿಜಿಸ್ಟರ್ಡ್. ಕಿಡ್ನಿ ಬರ್ತದೋ ಇಲ್ವೋ ಸೆಕೆಂಡರಿ, ಅನ್ಲೆಸ್ ಯು ರಿಜಿಸ್ಟರ್ ಯು ಆರ್ ಫೇಲಿಂಗ್ ಎಟ್ ದ ಫಸ್ಟ್ ಪಾಯಿಂಟ್ ಇಟ್ ಸೆಲ್ಫ್. ಸೊ ಈಗ ನಾವು ರಿಜಿಸ್ಟರ್ ಮಾಡಿದ್ವಿ, ನಮಗೆ ಆ ಬಂದದ ಟೈಮಲ್ಲಿ ಕಿಡ್ನಿ ತಗೊಳ್ಳೋ ಮನಸ್ಸಿಲ್ಲ ಅಂತ ಹೇಳಿದ್ರೆ ಯು ಕ್ಯಾನ್ ಆಲ್ವೇಸ್ ರಿಜೆಕ್ಟ್. ಈಗ ಕಿಡ್ನಿ ರಿಜಿಸ್ಟ್ರೇಷನ್ ಆದ ನಂತರ ನಾವು ಕಿಡ್ನಿ ತಗೊಳ್ಳೇಬೇಕಂತ ಏನು ಕಂಪಲ್ಷನ್ ಇರೋದಿಲ್ಲ. ಬಟ್ ಯು ಶುಡ್ ಬಿ ರೆಗ್ಯುಲರ್. ಈಗ ತಗೊಳ್ಳೋ ಮನಸ್ಸಿದ್ರೆ ಡಿಸೀಸ್ಡ್ ಡೋನರ್ ಅಥವಾ ಕೆಡವರ್ ಡೋನರ್, ಎಸ್ಪೆಷಲಿ ವೆನ್ ಐ ಸೇ ಅಬೌಟ್, ಈಗ ಎಷ್ಟೋ ಸಲ ಕೇಳಿರ್ಬೋದು ಪೇಪರಲ್ಲಿ, ರೋಡ್ ಟ್ರಾಫಿಕ್ ಆಕ್ಸಿಡೆಂಟಲ್ಲಿ ಯಾರೋ ಸತ್ತೋದ್ರು, ಬ್ರೈನ್ ಡೆಡ್ ಆಯಿತು, ಆರ್ಗನ್ಸ್ನ ಕೊಟ್ವಿ ಅಂತೇಳಿ. ಮೆಜಾರಿಟಿ ಆಫ್ ದ ಆರ್ಗನ್ಸ್ ಈವನ್ ನೌ ಗೋ ಟು ಚೆನ್ನೈ ಆರ್ ಬ್ಯಾಂಗ್ಳೂರ್ ಆರ್ ಆಲ್ ಮೆಟ್ರೋಸ್. At least in this 4 to 5 years now the kidneys are at least coming to Mangalore or Dakshin Kannada, Dakshin Kannadಕ್ಕೆ ಬರ್ತದೆ. So either let it be Manipal or Mangalore. So ಕೆಲವೊಮ್ಮೆ ನಾವು ನೋಡಿದ್ದೇವೆ ಕಿಡ್ನಿ ಬರ್ಲಿಕ್ಕೆ ರೆಡಿ ಇದೆ, ಬಟ್ ವಿ ಡೋಂಟ್ ಹ್ಯಾವ್ ರಿಸಿಪಿಯೆಂಟ್ಸ್, ರಿಜಿಸ್ಟ್ರೇ ಆಗಿರೋದಿಲ್ಲ. ನಾವು ತಗೊಳ್ತೀವಿ ಅಂತ ಹೇಳಿದ್ರು ಕೂಡ ಇಫ್ ಯು ಹ್ಯಾವ್ ನಾಟ್ ಗಾನ್ ಥ್ರೂ ದ ಪ್ರಾಪರ್ ರಿಜಿಸ್ಟ್ರೇಷನ್ at the last moment ನಮ್ಗೆ ಅದನ್ನು ಇದು ಮಾಡ್ಲಿಕ್ಕೆ ಆಗೋದಿಲ್ಲ. ಸೊ ಐ ರಿಕ್ವೆಸ್ಟ್ ನಮ್ಮ ಡಯಾಲಿಸಿಸ್ ಪೇಷಂಟ್ಸಿಗೆ, ನಾನು ಆಲ್ರೆಡಿ ನಮ್ಮ ಟೆಕ್ನಿಷಿಯನ್ಸ್ಗೂ ಹೇಳಿರ್ತೇನೆ, ಯಾರಿಗೆಲ್ಲ ರಿಜಿಸ್ಟರ್ ಮಾಡಬೇಕಂತ ಹೇಳುವ ಉತ್ಸಾಹ ಇದೆಯೋ ನಾವು ಯಾವಾಗಲೇ ಅವೈಲೇಬಲ್ ಇದ್ದೇವೆ. ಯು ಕ್ಯಾನ್ ಕಮ್ ಆ್ಯಂಡ್ ಟಾಕ್ ಟು ಅಸ್, ಮಾತಾಡಿಸ್ಬೋದು. ಅದು ಹೇಗೆ ಮಾಡ್ತೇವೆ ಅಥವಾ ಹೇಗೆ ಬರ್ತದೆ, ಅದ್ರ ನಂತರ ಹೇಗೆ ಲೈಫ್ ಇರ್ತದೆ, ವಿಲ್ ಬಿ ಆಲ್ವೇಸ್ ಬಿ ಓಪನ್ ಟು ಟಾಕ್ ಟು ಯು. ಇಷ್ಟು ಹೇಳಿ ಎನಿ ಡೌಟ್ಸ್ ಇದ್ರೆ at any time we are available. ನಾನಿರಲಿ ಸರ್ ಇರಲಿ, you can come and talk to us. I again thank all of you who gave me opportunity to talk on this occasion. Thank you.
I now request Dr. Ashok Pandit to speak a few words. Over to you, sir.
Dr. Mohammed Tahir, our medical director, my fellow kidney warrior, Dr. Kodialbail, my dear colleagues, my dearest patients, and ladies and gentlemen. First of all, welcome to this function on kidney awareness. It's a very important thing, we feel. We see it in everyday life, but marking a special day for it will make us concentrate and spend a moment and maybe save a life, certainly save a kidney. So, when I was asked to speak on this, I thought I would make it brief. So, as already Sean had pointed out, the aims is already there up on the screen to increase the awareness about the kidneys. Now, kidney diseases basically could be medical kidney diseases and surgical kidney diseases. As a kidney surgeon, I would probably concentrate on the second half. But as you can see at the bottom of the screen, approximately 1 in 3 adults with diabetes and 1 in 5 adults with high blood pressure are likely to have chronic kidney disease. And that's an absolutely huge number, because you know that India is the capital for hypertension, diabetes and cardiac disease in the world. Basically, probably because of a more sedentary lifestyle once we become adults and our food habits. And this is going to be a major headache. So I think Santoshbhai is going to be a lot busier than me, because this is practically universal. But then, what about the other half, which we could certainly prevent? We are talking about kidney stones, urinary obstructions, cancers, and congenital diseases. This is congenital pelvic junction obstruction, and this can be diagnosed even before the child is born. As you now know that even before delivery, most women, mothers would undergo 1 or 2 ultrasounds. So a substantial number of congenital pelvic obstructions are picked up even before birth. They are rescanned at first week, DTPA scan at first month, and most of these children we operate by the time they are 5 or 6 months old. In this very hospital, we've done several of them, and by the time they come to adulthood, you can hardly make out surgery has been done. But all these years, what used to happen was, only when they have a problem, then we would check and then do something. So this will prevent a congenital problem from actually harming the child when it becomes an adult, because a substantial number will wind up losing their kidney to this eminently correctable condition. Vesicular reflux. This is an important thing. Normally when you pass urine, it goes down from the kidney, thing that will come to post-urethral valve. It's not that we have anything saying that girls are any lesser. We just celebrated International Women's Day and we had a much bigger crowd. The point is, since the girls have shorter urethra, the chance of ascending infection is higher than a boy who has a much longer urethra. That's a simple anatomical fact. So if this is diagnosed and serious, the higher grades of vesicular refluxes are addressed, most of the time you can prevent kidney failure from happening. This is just a diagram of post-urethral valve. It's in the prostate there is a valve, which is an abnormal valve. It doesn't allow urine to come out, but you can always put a catheter. And this again is diagnosed very often even before the child is born. If it is very serious, very often they are stillborn, but a substantial number are born and then they have a lot of problems in adulthood. By the time they become teenagers, they will have problems with the bladder pressures, kidneys failing and all that. So if they found early, they can be addressed, and we do that in this hospital as well. A very, very common condition. I'm sure most of us have had stones, or we know somebody very close to us who had stones. Simply because it's a busy lifestyle, we don't have time to drink water. It's becoming hotter and hotter every year. Universal, warming, global warming. So stones are practically everywhere. And these stones, many people what they do is we tell them you've got a uritic stone blocking your kidney. Please make sure that either it passes or you remove it within 2 weeks. You will find the fellow sits on it for 2 months, 3 months, or maybe a year, because he's afraid of surgery or some such thing. And cost again now is not a problem, because we are using patients can avail the Ayushman Bharat Arogya Karnataka facilities right here in this hospital. I can do practically all the surgeries on that. It's very, very affordable. So if you wait too long with an obstructed kidney, you could damage it, and this certainly is an avoidable kidney damage. Kidney cancers, renal cell carcinomas, the standard of care up till about 15-20 years ago was to remove the whole kidney along with all its coverings and then throw it out. Because chemotherapy wouldn't work, radiation wouldn't work, if you don't take it out on time, you will die of the cancer. But now, for the last 15-20 years, we can only, in most of the cases, again, because they are detected very early because of all the ultrasounds, you can remove only the cancer with a very thin rim of the normal kidney, and the effect is as good as removing the whole kidney, because people are living much longer because of, access to healthcare, better knowledge, and when I think India got independence, the average life attends to diabetes and hypertension. Almost every day, I spend about 15-20 minutes extra with each patient who has diabetes, simply telling him about the ill effects of diabetes on the kidney and how you should keep your hemoglobin A1C within 7%, how you should check for urine microalbumin, because like we just mentioned, until the damage is very much advanced, your blood test is not going to show it, because the fellow just looks at serum creatinine and says, oh, my serum creatinine is 1.2, up to 1.4 is normal. I'm normal, nothing is happening. Your house is on fire. That's what's happening. So it is the duty of the treating physician to tell the patient and warn him that you're going to be in dire straits. And certainly I don't treat diabetes, I don't treat hypertension, but I do treat kidney problems and then kidney failure and transplant. That's why I make it a point. And I think all the physicians or any doctor who sees a diabetic or hypertensive should spend a couple of minutes, and this will go a long way in increasing the awareness. Avoid non-steroidal anti-inflammatories, brufen and diclofenac. Although we do use diclofenac because of the ease of use, one single shot. Make sure our casualty officers don't keep giving 3-4 injections of diclofenac to the same urinary colic patient, because you will create more damage than the stone itself. And avoid a high protein diet. Because this, Dr. Santosh Bhai just made a mention about organ donation. You saw, I think, the first, there was very much in the news about the first organ donor from AJ Hospital a couple of years ago. Up until very recently, the only places where cadaver transplants were going on were in Chennai and Ahmedabad. And now, if you look for the population concerned, I think Mangalore has got the highest cadaver transplants going on. And I think we should keep this up. There was a move at one point when a young boy or a girl gets a driving license, they should actually include this organ donation card along with that. That's when they're just out of PUC, they'll be the maximum Josh, and that would probably go a long way in helping this cause. So thank you very much for the patient listening. This, of course, we can't do anything worthwhile, kidney or otherwise, without our wonderful staff. Many of them over here. So thank you.
Thank you, Dr. Santosh Pai and Dr. Ashok Pandit, for this awareness talk session. So it would be incomplete without asking the questions in there. Please, you can raise them now. Otherwise, we'll be proceeding ahead for, yes please. There's a gentleman over there, the last. If anyone can give him a cordless mic.
ಹಲೋ, ನನ್ನ ಹೆಸರು ಜಗನ್ನಾಥ್ ಅಂತ. ಸಾಮಾನ್ಯವಾಗಿ ಮನುಷ್ಯನಿಗೆ ಪೇರ್ ಆಫ್ ಕಿಡ್ನೀಸ್ ಇರುತ್ತೆ, ಕೆಲವು ರೇರ್ ಕೇಸಲ್ಲಿ ಸಿಂಗಲ್ ಇರುತ್ತೆ ಸರ್. ಸೊ ಹಾಗಿದ್ದಾಗ ಯಾವುದೇ ಜಾಗ್ರತೆ ತಗೊಳ್ಬೇಕು, ಅದರಿಂದ ಏನಾದರೂ ಪರಿಣಾಮ ಇದೆಯಾ, ಅದ್ರ ಬಗ್ಗೆ ನಿಮಗೆ ಸಜೆಷನ್ ಇದೆ?
ಥ್ಯಾಂಕ್ ಯು. ಒಳ್ಳೆ ಪ್ರಶ್ನೆ ಅದು. ಕೆಲವಾರು ಕಿಡ್ನಿ ಮಾಸ್ ನಮ್ಮ ಹತ್ರ ಒಂದು ಕಿಡ್ನಿಯಲ್ಲಿ 1 ಮಿಲಿಯನ್ ನೆಫ್ರಾನ್ಸ್ ಅಂತ ಫಿಲ್ಟರ್ಸ್ ಇದೆ. ದೇವರು ನಮಗೆ 2 ಕಿಡ್ನಿ ಕೊಟ್ಟಿದ್ದಾರೆ, ಸೊ 2 ಮಿಲಿಯನ್ ನೆಫ್ರಾನ್ ಇದೆ. 1 ಮಿಲಿಯನ್ ನೆಫ್ರಾನಲ್ಲಿ ಜೀವನ ಆರಾಮದಲ್ಲಿ ಮಾಡ್ಬೋದು, ಆದರೆ ಅದಕ್ಕೆ ಏನು ಟ್ರಬಲ್ ಮಾಡಬಾರ್ದು, ಅಂದರೆ ಉಪದ್ರ ಮಾಡುವಾಗೆ ಮಾಡ್ಬೋದು. ಅಂದರೆ BP ಇದ್ದ ಪಕ್ಷದಲ್ಲಿ ಟೈಟ್ ಕಂಟ್ರೋಲ್ ಮಾಡಬೇಕು, ಶುಗರ್ ಇದ್ದ ಶುಗರ್ ಕಂಟ್ರೋಲ್ ಅಬ್ಸಲ್ಯೂಟ್ಲಿ ಪರ್ಫೆಕ್ಟ್ ಇರ್ಬೋದು, ನಿಮಗೆ ಯಾವುದೂ ಲೀವೇ ಇರೋದಿಲ್ಲ. ಮತ್ತು
So does anyone else have any questions? ಬೇರೆ ಯಾರಿಗಾದರೂ ಏನಾದರೂ ಕೇಳಲಿಕ್ಕಿದ್ರೆ? Is it done? All right then. So to conclude, living in a state of gratitude is the gateway to grace. To share our gratitude for making this event possible, I now request Dr. Radhika to please come forward and deliver the vote of thanks.
To grace this occasion. Thank you, sir. I would like to thank our guest of honor, Dr. Santosh Pai BH, for accepting our invitation and for sparing his valuable time with us. Thank you, sir. I would like to thank Mr. Ganesh Shetty for accepting to join the program in a short notice. I express our hearty thanks to Mr. Shekhar Moili, Mr. Ramachandra Bandari and Mr. Harish Shetty for gracing this occasion. It is a great opportunity to express my gratitude to our beloved Medical Director, Dr. Muhammad Tahir, who is the source of inspiration for every program in our institution. I thank you for your humble presence. I would like to thank Mr. Sean, Dr. Swati for completing the program successfully. I would like to thank the Corporate and Relations Department, IT Department, Photography and Videography team, the maintenance team for your support. I extend my great appreciation and thanks to our management for their support and encouragement on this occasion. Lastly, I would like to thank our audience for your joyous presence. Thank you, one and all.
So to conclude, thank you all for being here today. There's a refreshments that's been served in the entrance of the hall. So please have them before you leave. So we just hope that the awareness talk that we have received from both the doctors would help us to be careful, and also we'll be aware of imparting good knowledge to others who are in need of it, and continue to serve people here at Yenepoya who's having any kidney issues. So thank you so much once again. I hope you all have a great day. Thank you.